So the other day in the office, I had a patient come to me because I had performed a procedure on her friend where we injected Botox into the bladder, and she had a really good result, and she talked to her friend about it. So her friend came in and she was wondering if Botox would work for her as well. And that brought me into a conversation which is pretty important for anyone that's having incontinence. There's really two types of incontinence. The first one is urge incontinence, and that's when the bladder contracts in a way that's sort of uncontrollable. And when it goes into this type of spasm, then there is leaking of the urine because it's a non-volitional contraction. It's an unintentional contraction, meaning the bladder just decided to contract without you asking it to contract. So that's urge incontinence, and it develops while where increasingly before having the incontinence you might have some urgency. So if you have to go to the bathroom right away, you rush to the bathroom, and sometimes you make it on time, sometimes you don't make it on time. And when you don't make it on time, we call that urge incontinence. Another type of incontinence that is also very common is called stress urinary incontinence. So stress incontinence. Stress incontinence is when you cough and then there's some leakage. You cough and then there's some leakage. You might bear down as if you're having a bowel movement, and then you have some leakage. And what happens there is that the bladder is not contracting against your will, but when there's an increase in the pressure in the abdomen, then there's a bit of a descent in the pelvic floor. There's a bit of bladder sags a little bit, and that produces a leakage of urine. And this is stress incontinence. It's very common in women who've been through labor. Studies have shown that what makes a big difference is not whether you've had children or not, but rather whether you went through labor. So if you've been through labor, but then you had a cesarean section, you would still be at risk for stress urinary incontinence. Now, some of the stuff that we can do to prevent stress incontinence is Kegel exercises, and those are muscles that help build and strengthen the pelvic floor, and they help prevent this sagging of the bladder when there's an increase in the pressure in the belly. So when you're coughing or sneezing or laughing, and when you're laughing, if you notice, you'll have like you're contracting your abdominal muscles, and that increases the pressure inside your belly, which pushes down on the bladder and has this the bladder sort of sags. So when this happens, then the pelvic floor, if it's well supported and if it's strong because you've been doing Kegel exercises, then that can help prevent incontinence. To a certain degree, however, this is the sort of caveat with Kegel exercises, is that eventually they stop working. And the reason why they stop working is because the real problem with pelvic floor prolapse or weakening in the pelvic floor is actually not the muscles, but rather the tendons or the fascia that tie the muscles into the walls or the bones of the pelvic wall. So you have your bones of the pelvis, and those are tied through tendons or through fascia to the muscles. They're not really tendons, but the reason why I'm saying tendons is because I want to use the analogy of a muscle of a bicep. If your tendon of the bicep is injured, let's say you're a sports person and somehow you had an injury to your bicep tendon. Well, there's no amount of strengthening of the bicep that's gonna make up for the fact that your tendon is injured. And same thing for the pelvic floor. When you're doing Kegel exercises, you're really exercising the muscles of the pelvic floor. And there's no amount of exercising the muscles of the pelvic floor and making them stronger that's going to make up completely for the laxity in the fascia that attaches those muscles to the bones. So eventually Kegel exercises stop working, and then you can have a procedure to help re-elevate the fascia, re-elevate the bladder, or support the urethra, so that way when you have this increase in the pressure inside the abdomen, you have something else to act as a floor in order to prevent the sagging, the over sagging, if you will, of the bladder and the urethra and the leakage of urine. So I hope this helps you make the difference between urge incontinence, where the bladder is contracting before you ask it to, and that's when the bladder is being too spastic, and stress incontinence, where there's a weakening in the pelvic floor, and when you're coughing or sneezing or laughing, and that leads to the incontinence.